thank you once again, Johan, because we've already got a lot to learn from you. But we're starting out, and we've had some interesting meetings with the steering committee before the event, and I think that's helped us to put together a little bit more information for this particular presentation. So I'm going to talk about the global communication campaigns and resource sharing across our Alpha One global community. So what are our Alpha One global communication objectives? Well, what we can see as key areas of interest are the awareness campaign and a communications plan. The communications plan, well, we started to work on it perhaps at the end of last year, and we engaged with Leonor, who'd helped with us on COPD Global, and myself from Love Air Foundation in Spain with some of our resources. And we put together a beginning point, a starting point, if you like, to move forward with that. Basically, it's been focused on this event, the biennial event, because we had about 5-6 months, I think, to move towards the goal of the event, the planning, the agenda, etc., and the kind of communications we thought that would be relevant in this context. So once the event is over, we will then go into another stage and look at the next year forward and what kind of media and communications support we think that Alpha One Global would benefit from. Obviously, we did the survey as well, which was a starting point, and we realized how important the data collection is. So we got some interesting results back from the survey, but we definitely believe that we need to go further with that and get some more accuracy. So building on our current network and growing a worldwide community, we need a roadmap to do that. It's been helpful to see your route with our iPoppy, and I think that's also a good guideline. We've got some ideas about focusing on particular areas and regions, just as you mentioned, and we're hoping that we'll go into further discussions about that after the Congress and meeting with the patient leadership this event during this Congress. So developing a 3-year strategic plan, it's also something that we've begun to look at, and again, I think that based on the results of the meetings we've had and the feedback from the survey, then we can take that into a much more concrete document so that we can use that for the next 3 years. So we know that with Alpha One, our key areas of interest are awareness, increased awareness, detection of alphas, still very underdiagnosed and misdiagnosed, and also the access to care for alphas. Care including standards of care as well as therapy. So from the survey, the top priorities that came back from everybody were to maintain the biennial Congress as a meeting point, which is very important for patient leadership, and also to engage more with the scientific community, to work on a global and/or national awareness campaign, and it was interesting to see how you're focusing in different levels. I think the feedback that we got from people in the survey also came across that way. And to some people, it's more relevant to have a national campaign because of the cultural specific situation or the political situation they might have regarding access to care, different systems, and so on. And for early detection for alphas, well, the aim is, I think, really to direct our campaigns at 2 levels, at policymaker level, but also at healthcare provider, because unless we get the physicians on a better level as regards to the importance of detecting Alpha One early, we're still not achieving our objective. So I think we have a 2-pronged attack there that we need to take on board. Access to treatment for lung-affected alphas, that's of course very high on the list, and also adapting the advocacy toolkit and give training support to organizations to present to the key opinion leaders, the politicians, the regulators, and policymakers. So I know the US is very advanced in this with Alpha One Foundation and COPD Foundation. We can learn a lot from your work in the EU, because we've still got a long way to go with that, although Alpha One has in the past engaged at certain levels. I think the partnering across the networks is going to be very, very useful in that respect. Could help to fast track the situation, which would be wonderful. As we all know, these things can take years to build up confidence and trust amongst this sort of level of partnership. So we go back again to the survey and the situation. We can see the results from that. And I think we need more precise data from countries in order to get more qualitative information. We can see a slow growth rate, really, in countries in patient organisation membership. And that's really probably mostly due to the slow identification of alphas in diagnosis, because the two really go hand in hand. The number of alphas, country to country, varies considerably, obviously from the US to Canada, which Canada has a high number, and Western European economies with 500, 800 to Germany. And Eastern Europe really just beginning off, and Latin America the same. So the diversity between the countries is very obvious, and also there's low management figures really of children who are detected and the follow-up for the young adults. I mean, my alpha son is 16 now, so I can see that at his point in life, he's not so interested in alpha-1 at the moment. You know, he was a controllable entity when he was an infant, but now this has gone off the radar. And also I think we have to be aware that young people engage with social media, and I'm not sure that they're really interested in the traditional patient organization model. And I think maybe we have to think about different ways of engaging their commitment to carry on with us, because really in the future, they're going to be the ones that are going to lead these kind of movements. So it's got to be attractive for them as well. So the capabilities that Alpha-1 Global has, which are, I would say, an R&D stage at the moment in year 2015, is that we can offer basic communication and networking support. There's an Alpha-1 Global website. We're initiating ideas about the sort of tools and things that we want to bring in to support across the organizations. An awareness strategy, we're beginning to look at that. An early detection strategy, after our conversations in the last few days amongst the steering committee, we've got some ideas. And an Alpha-1 advocacy toolkit, which we think we could set up a pilot version of that, and we would be interested to see the countries that would be interested perhaps in joining in the first stage. As you recommended, perhaps better to have a regional focus or not take up too much initially, but certainly it would be interesting to select a number of countries that would like to work with us on that advocacy toolkit. So the situation for Alpha-1 and the steps to be taken with your help and contribution. So we believe we should prepare some guidelines on perhaps an improved survey, needs testing, post this Congress, and get some more specific information. So that's something we'll be taking on board probably almost immediately, I would say, May, June, that sort of date. But be prepared, because we do want you to complete the questionnaires and help with them. For numbers diagnosed, for registries, for awareness, for testing and detection, and for therapy and reimbursement. The more accurate information we can achieve with this, the better picture we've got, and the better we can work on an advocacy toolkit, whether it be regional specific or globally. And that will also help us to design our media information and our communications plan. The steps to be taken again for communication with your help. Well, we're very happy to say that Cristina Barbiero, and I'm not sure if you've all met her, but Mario Ciuffine, who unfortunately passed away 2 years ago, Cristina Barbiere is his very elegant wife from Italy, and we're delighted to have been able to engage her on an awareness campaign project. Now, Cristina has very capable knowledge in this area. She works with the J. Walter Thompson Agency in Italy at executive level, and they've offered to help to prepare a brief for a video clip for an awareness campaign. So thank you very much, Cristina. it's a very welcome collaboration for the steering committee to move forward with this. This is something we're going to do quite intensively, so we are going to ask for more information from you, perhaps on your past campaigns, things you've used, items that you think have produced good results, so we can compile the information, analyze it, and perhaps look at some of the best ideas or possibilities that we should employ in the strategy. And we do need your collaboration in this process, which will take some time. We prefer to do this well and do a good job rather than just charging ahead with any option. So what steps can we take for early detection? Well, with your feedback from the survey and the ideas from the steering committee, we have begun to look at possible ways and the important focus areas. So it's clear that we need to look at alternative ways of making test kits directly or more easily available to potential alphas. This has to be a cost-effective solution, and it has to have good logistics. So they're easily distributed, they can go back to the screening centres, and this needs to be done in different ways, probably for different regions. For example, for Latin America, for Eastern Europe, Central Eastern Europe, we saw the examples of Poland yesterday from Joanna Chorostowska, which I think is an excellent example of the work done in the last few years. And these kind of models we could look at amongst countries, seeing where they're working well, how we could set up a similar infrastructure reasonably with the physicians and with the patient community initially, and then get in other stakeholders from industry and so on to look at the possibilities of helping us to make these models be viable and work. So we're also looking at the opportunities that we may have now with mHealth, app solutions for physicians to better improve their ability to think of alpha-1 or to test. Nowadays with mHealth, there are so many different areas of diagnostics which are coming across, diagnostic testing, that we think we could explore this, and perhaps we could set up a workshop with healthcare professionals, industry, technology and key stakeholders, which was sort of task force focused, and we could move forward with that and come up with a solution which could benefit everybody in all countries. So looking at the communication resources and the survey feedback and the comments from the steering committee, we know that here we can network better with the key opinion leaders across countries. We can begin to improve digital support on global interest areas, which we know that the blog was an interesting point from everybody. They were interested in keeping up-to-date information, research information, etc. The social media we think we should use in a timely way, because we already know that the Alpha-1 global community is very active with their own Facebook pages, Twitter, etc. So we'll be looking at ways of perhaps optimizing that, not taking on yet a new digital space that people really don't want to go to, but something that is timely and useful for the different patient leaders and patient organizations. Working on the global awareness campaign, and resource sharing on education materials and translation into other languages from those materials that are already existing in the community. We know that the Alpha-1 Foundation has already extensive library of publications and education materials. Canada's doing well now with new material for children, Australia, etc. So I think we can share across different countries. Some materials may be better for the new regions than others. It's a question of evaluating that. So within the steering committee, we've talked about this already, and we've talked about perhaps having a specific person who would be in charge of evaluating or looking at these and having more information, and be the go-to person for that element or that resource that can serve the global community. So how to grow the Alpha community? Your suggestions and our joint tasks here on a national level is better engagement, clearly, with physicians and support for national screening centres. We can see the difficulties with registers and the financing of those. But if we all come together as a community, I'm sure that the models that we pick, and some of them will have patient-recorded outcomes as well as physician engagement. I think the models of the future with electronic health records are going to enable us to do this. Of course, everybody's worried about data concerns, data privacy, etc. But we do know that there are already excellent models of registries which exist across many communities and many diseases. Cystic fibrosis has good examples. The Alpha Foundation, COPD Foundation has excellent models. So there are tried and tested models that we can work on and perhaps build for our community and make them more affordable. And the idea of coming together as one is that we can perhaps, and we should be able to, is encourage cost efficiency in the kind of services that we can supply across the countries to the different patient organisations. I think we have to accept that not all patients will become members in the traditional sense of the word, but as social media users, there are ways and techniques that you can encourage better engagement and proactive participation in specific events. I was interested to see the recruitment for the clinical trials that you've been doing in Australia directly across social media. So I think we have to think of the community perhaps in a more flexible way. It isn't always the traditional membership, although you would like to convert everyone into that. But they are there, the alphas. We just have to know how to reach out to them, manage them, and have some sort of communicative relationship, which is going to be useful for us in the future as resources. Engaging with related national umbrella organisations to share media attention and resources. I think you've expressed that very well, Johan. That's essential, whether it be rare disease, whether it be lung, whatever. But look for the partnerships that are going to be positive. You know, the glass can be half empty or it can be half full. And I think identifying with people who want to positively move forward and make a difference or become more active in their community is actually really important. Otherwise, you can waste a lot of time in this area cultivating relationships which aren't going to move you in the direction you want to achieve with your objectives. So using creatively digital presence, I think, is also very important nowadays, and encouraging the ownership and participation. I know that there are some very interesting platforms like that are coming around with social media engagement, to encourage patients more, have peer-to-peer relationships and share on a global level. So I think we should continuously look at and update at these, and usually engaging young people in this who are much more up-to-date on the use of these kind of tools is very important. So what steps can we take for access to therapy and standards of care guidelines? Well, regarding your suggestions and the steering committee comments, I think we all have to be realistic about the cost of therapy. You know, in this room there are countries whose very difficult to achieve the cost of therapy. So we need to be realistic about that, and maybe we need to also work together and see how we could make a difference on the cost of therapy. Could we actually work to reduce it if we advocate enough, if we campaign enough, if we talk to the right people? I think also we didn't touch on this, unfortunately, but the health technology assessment tool that you had worked on also with IPOPI and with Brian Mahoney in the World Haemophilia is an area that the Alpha community has been interested in engaging in. So that could give us an ability to justify the cost effectiveness over lifetime for an Alpha, and it's something that we really want to take on board as an additional tool to support our advocacy campaign. Advocacy support, well, as we've said, to adapt the toolkit to train patient organisation members or procure services to support better engagement with healthcare policymakers. We want to go into a pilot. We could be looking at workshops. We could be looking at virtual conferencing to initiate an analysis of the countries and way forward with some coaching from people who are trainers. I think there are different ways we could perhaps deliver that initially, but that's probably one of our key areas, I think, in this next year. So I'd like to finish on saying, what is your role in Alpha One Global Communications, and how can you help to participate and contribute? Because this is really a give and take relationship. We want to be there to help you as a steering committee, but we also want you to engage I think the partnership and the strength of the relationship that we keeping in touch, follow up, is absolutely essential to making this a strong community and a growing community. So please, open up the dialogue, ask questions, share your ideas, enter into discussion during the sessions, during the lunch, after, and keep going after the Congress, and please contribute to our community. Thank you. Does anybody have any questions or comments? Very quiet. John? No? Nobody wants to say anything? Well, later, perhaps. Okay, thank you very much. So, housekeeping. We all have to be back here at 2, and Meet the Alpha 1 experts is during the lunch session. It's afterwards at 2, in this room. In an informal setting? Yes. Can you bring your questions after lunch, please? Yes? Oh. Right, it's there. All right, well, I think we've finished then for lunch. Thank you very much, everybody.